Hi, I'm Mary Colbert. Welcome to Dr. Colbert's Divine Health Podcast. And this is Dr. Colbert.
Hey there. We're excited about today's talk. We're talking today about low testosterone, low T. There's lots of low T clinics out there, but many of them are just prescribing way too much testosterone, and people are getting in trouble having too much testosterone. But first of all, the problem we're seeing is more and more men are getting lower and lower testosterone at earlier and earlier ages. I'm seeing guys getting low testosterone in their early 30s now and even late 20s, Mary. It's crazy what we're seeing.
You know, I think this is an important topic in so many ways, especially with what's going on with the youth. I know that I had a grandson who is now 25. His testosterone did not kick in until he was almost in his 20s. So what happens is everybody's a little bit different, and the testosterone is what makes you a man.
Yes, testosterone is what gives men their muscles, their strength, their stamina, the wide shoulders, the small waist, the beard, the hair growth, the hair on the chest. And so that's, again, testosterone. It's the manly hormone. But the symptoms of low testosterone, the first thing we usually see, low sex drive, no libido or very low libido. They start to lose hair. Their beard growth doesn't grow as much. They lose axillary hair. They also are tired, but not just tired. They are bone tired. It's a whole new level of fatigue, Mary. Other symptoms of low T, I'll just go through them, are grumpy and irritable. These could be young men in their mid-40s or early 50s. They become grumpy old men, grumpy and irritable. You don't want to be around them. They get home from work, they sit in their recliner or on the couch, and they fall asleep within a few minutes.
So do you see what's happening? You have women who are tanking in progesterone who are now irritable. Men are tanking in testosterone.
And neither one of them have sex drive.
And they're arguing with each other and are irritable. And
grumpy
it's like,
and irritable.
Folks, this can be fixed.
And these are hormones. These are powerful natural hormones. They're the spark plugs of life. We've not found any vitamin that can work this good. Now, yes, there are supplements that can boost it, but there's nothing as good as the natural testosterone, the bioidentical testosterone. We can now give it in creams, in pellets, in shots, in sublingual tabs or troches. It is so easy. And I give it for men and women. Women need it just as much as men.
I can't wait till we get into the women's, because that's going to be huge for women to hear.
And most doctors don't prescribe testosterone for men or women. The majority don't. They're afraid it causes prostate cancer in men, whereas it prevents prostate cancer. We'll talk about that later. But the symptoms, other symptoms, loss of muscle mass. I've seen so many guys that come in and they say, I don't know what's happened. I have no strength, no stamina, and my muscles are shrinking. I checked their testosterone. It's in the toilet. It's in the low 300s or low 200s or mid 200s.
Okay, now listen to this, because this is very important right now. That you need to know this. That normal levels for men in 1930s.
Well, 1940s. The 1940s. The high limit of normal used to be 2,500.
2,500 in the labs. That was considered high. Now, let me just explain something. Please let me say this.
Go ahead,
okay.
Yeah.
The way they gather normals in labs is they do it by the herd. You know, they take what is normal according to the crowd or the population.
Instead of the curve. We look at the curve. Then we look at 2 standard deviations out.
So from that, they do the blood testing of the herd, I call them. We're all in a herd, bunch of cows. And so they take the blood test, and then from the blood test of the herd, they deem what is normal, what is high, and what is low. Folks, listen. Please hear this. In the 1940s, the herd, the high normal was 2,500. Do you know what it is today? The normals of what they call today?
923 is the high limit, is what they say now. That's most labs.
920 is now the high. What has happened? The men's testosterone normals have tanked.
They have, due to all these chemicals we're exposed to that I'll discuss in detail. The the plasticizers, the phthalates, the bisphenol A that's in 75% of canned goods that you eat, canned beans and things. That is bisphenol A that really tanks your testosterone. Parabens that are found in shampoos, conditioners, skincare products. They contain parabens that are antimicrobials that lower testosterone levels and boost estrogen levels, as well as most every pesticide. And most everyone consumes pesticides when they eat any foods, especially meats. The pesticides are stored in the fat of the meat. When you eat fatty meats or butter or cheese or any kind of dairy that's high-fat dairy, you're getting lots of pesticides, as well as farm-raised fish, tons of pesticides, as well as most any produce. They spray pesticides on the produce if it's not organic, and those are mostly type estrogens that actually will lower testosterone levels. The majority will. So that's what's happening.
There is a feminization going on.
Yes, it is.
Against our men.
It's not messing with your partner. Yes, a man will always be a man with an XY chromosome. But what's happening, we're seeing a feminization of our men through a lot of these xenoestrogens.
Now, listen, truth is truth. You can't change truth. Truth is truth. And the truth is, when you are born, you're either XY or XX.
XY is a male, XX a female. You can't change that. We can go back and we could actually dig up bones from thousands of years ago. We can tell if it's a man or a woman.
Period. You can't change it. I don't care how you feel. You know, I used to think at one time, what if there's reincarnation going on and somebody comes back and they were a female in another life and now they're a male? And maybe that's where it's coming from, a reincarnation problem. No, I'm just kidding.
Yeah.
But the thing is this, we are hormones.
Yes,
we are hormones.
Mary, these hormones are so critical. They're the spark plugs of life. When your hormones crash, and they start to crash, and most people are in their 40s or 50s, and men and women, the first hormone to crash is your testosterone at age 40. It's literally half of what it was before that. In men, it's usually at age 50, 10 years later. Then that hormone crashes, and then all of a sudden, you become literally exhausted. You have no libido. Your shoulders shrink, your waist expands. And by the way, men that are obese with big bellies, they usually have low testosterone. Type 2 diabetics, they usually have low testosterone. You need to get it corrected because so many of my diabetics and my obese guys, when I get them on testosterone, that belly, if I get them on the right diet, the Beyond Keto diet with the exercise program, with the supplements and the Carb Assist, 1 twice a day, all of a sudden that belly shrinks. Their muscles come back. Their sugar starts to come down to normal. It is amazing how the body transforms when you put these simple things together. But the testosterone is the spark plug of life for men and women. It's critical.
Now, I mentioned that I had a grandson whose testosterone kicked in late. Ladies, listen to me. This is important. If you have a young boy, grandson, and he may be acting a little feminine, and he's not fully developed yet, don't you dare put in that kid's head that he's gay. Don't you dare try to make him think that maybe he's a girl. That is crazy. Some people's testosterone
They're late bloomers. Yeah.
Late bloomers. You give that child a chance to form and to grow. To do anything other than that is just criminal.
And if they're 18 or older, we put them on our testosterone zone. This will help to boost testosterone levels. Just 3 in the morning.
So don't be discouraged if you see your grandson or your son is acting a little bit feminine and you're thinking, okay, they're gay or something. No, you need to stand against that because they could be very well just late developing. And so you just speak to them and you pray over them and get them to a doctor, get their blood test done, and you get it checked because there are things you can do to help kick in that masculine side of them. Absolutely. So that they don't develop teasing from kids that, oh, you're this, you're that, and the labeling begins.
And we have natural things that'll boost it too.
Right.
But again, a common symptom of low T in men and in women is depression, grumpiness, irritability, and depression. Testosterone, of all the hormones, is the best antidepressant of all. Now, the hormones for women, estrogen, is also has antidepressant effects by raising norepinephrine, an important neurotransmitter. Progesterone, natural bioidentical micronized progesterone, also has antidepressant effects by boosting serotonin, but it is the testosterone that has the greatest antidepressant effects. Absolutely amazing. It boosts not only the norepinephrine and the serotonin, but also the dopamine. Dopamine is amazing at helping you feel good. That's why chocolate helps so many people feel good. It boosts dopamine. But dopamine is that magical neurotransmitter that is just amazing for depression. And when I put these men on the right dose of testosterone, we get that level optimized, not just balanced, but at the high end of normal. It is amazing how their minds change, their bodies, their outlooks, their attitudes, and how depression lifts. It's the best antidepressant I've ever seen.
I have to tell you, medical science has done amazing things, and we have come a long way in science on so many things. But there is one area it has not caught up, and it's in this area of the hormones.
No, they're still using synthetic hormones.
More people have been screwed up, and I'm going to use that word because that's exactly what's happened, with wrong information, with wrong treatments and medicine. And you've got to fight for your kids. You have got to fight for your grandkids to make sure they're getting the right answers. I'm telling you, Don, this is a huge problem in our society right now.
Well, Mary, let's talk about some of the benefits of testosterone, because most people, there are 10 key benefits I see all the time, and I see this every day in my practice. Number one is testosterone. Again, it's that spark plug of life. It decreases inflammation in the body. As we age, especially over 50, inflammation increases, and most all chronic diseases are driven by inflammation, especially arthritis, chronic pain syndrome. So we find testosterone helps decrease inflammation dramatically in so many of my patients. Less arthritis pain, less muscle soreness, less muscle fatigue. Patients with chronic pain syndromes and fibromyalgia generally improve with testosterone when combined with a full program, a dietary program like Beyond Keto, along with natural anti-inflammatories like boswellia and curcumin, along with natural nutrients that help support joints like our collagen, glucosamine, chondroitin. When you combine these together with testosterone, it's absolutely amazing. Number two, after inflammation, it helps with muscle growth. Remember, when men get to be in their 60s and 70s, and women and 80s, we develop feebleness or frailty syndrome, or there's a word for that called sarcopenia. Sarco, muscle, penia. In other words, the muscles atrophy and degenerate, and we lose muscle strength and stamina, and we get weak, and we can't open jars, and you need help with getting out off the toilet or out of the tub. And these are the people that end up in the nursing homes. Now, here's what happens from age 30. After 30 to 60, we lose on average of a half a pound of muscle per year from age 30 to 60. That means in 30 years, we lose 15 pounds of muscle, but we gain 1 pound of fat per year. So we lose 15 pounds of muscle, we gain 30 pounds of fat. By the time we reach 80, we have lost 40 to 50% of our muscle mass.
That's crazy.
So that's why so many people in their 80s or late 70s end up in nursing homes. They fracture a hip. The main cause of going to a nursing home? Hip fractures and dementia, those two. Do you know that testosterone protects you against dementia, and it causes the strongest bones? Anyone with osteoporosis, I put them on testosterone. It builds strong bones. A man with osteoporosis, most people with osteoporosis are women. They're 4 times more likely to develop it. But men, I find a lot of men get osteoporosis. I reverse it with testosterone. I put them on shots or pellets or creams or sublingual troche, in any one of those. But the best is for men is shots. It's the cheapest, but the pellets work the best, but they're more expensive. Okay, so either one.
I'm telling you, if you are listening to us and you hear us on YouTube or you're hearing us on a podcast, you need to know something very, very important. And that is you need to know your testosterone level.
Now let's tell them what's normal.
It is important you know it, and insist that your doctor do the blood test.
Yes.
because this is one of the long-life hormones you need to know.
Now, also, here's what the American Urological Association says. A man with a testosterone level less than 300 nanograms per deciliter should be diagnosed with low testosterone. The range in most labs, they say low is defined as less than 265 and high is greater than 923. So again, I push those levels up a little higher, up to 1100 for men. And if a man's testosterone is in the low 300s, they have literally no testosterone, and they feel horrible. They'll have every one of these symptoms.
They feel horrible.
And
they're grumpy.
If you're less than 40 with these, it's going to be real tough for you to function in life, to maintain a job, to maintain a marriage, to be a man. It's almost impossible with levels that low. You got to get your testosterone levels at least up to around 600, 750. At least to that, and even up to 900 to 1,000 is even better.
Ladies, make a note. You need to make a note. So when you go to the doctor and you take your husband or your son or whatever, get their blood test. You need to know this, and you've got to look at the numbers. They are important. You need to know your numbers on everything. You need to know your blood pressure number. That's important. You need to know your cholesterol number. That's important.
Right.
You need to know testosterone numbers. These are important.
The total
numbers.
and the free. The free testosterone is the actual active form of testosterone gets inside the cell. So very few doctors run the free testosterone, especially in men. Critically important.
Free testosterone.
And total testosterone. You want
and
them
total.
both.
You want two.
Yes.
Yes. Okay, that's important.
Now, another thing that testosterone does, men and women, it boosts your energy.
Yes.
This is for men and women. It is amazing what happens.
Dawn just did my blood test, and because we travel between two cities, and I'll just tell you right now, I'm turning 70 this year. My birthday's in a few months, and I turn 70, okay?
And you were exhausted.
And I'm exhausted. And I thought, I don't have any more lemon juice.
That's right.
I am squeezing
And we checked
dry.
your testosterone level, and it was less. Now, normal in women is 15 to 50 in most labs. Some labs may push it up to 70, but some labs say that a testosterone level in women should be only 5 to 50. If you're at 5 or below, you're on E.
You're almost in the coffin.
Yes, but if you're less than 15 women, you're on E. You need testosterone. That gives you energy, vitality. I got to tell you a story about a lady that's 70.
I got to finish mine.
Okay, sorry.
We're talking about me.
Yeah, go ahead. Okay, go ahead. Tell your story.
And the thing is, he went and he did a pellet. He saw it and went, Mary, he explains why you're so tired.
And your adrenals were exhausted.
My adrenals were exhausted. And I'm like, I am tired. And so, true story.
Last week.
What happened last week? In our house in Florida, I have a fairly large closet because I like clothes and shoes, and I have to have a room for that. So the other thing is, I think I'm going to be in that size one day, so I hold on to everything.
These clothes are 40 years old.
I have 3 sizes in my closet. The one I used to be, the one I kind of stay at most of the time, and then I have the, oh my God, what has happened to me size.
The moo-moo size.
So.
The moos.
So what I do, I like a lot of women, I kind of hold on to things, and so it's gotten kind of, you walk in my closet and it's like.
Disaster zone.
It looks like a ball.
Stress zone.
And it's a very, very large closet, so that's pretty embarrassing. He gave, and I've been talking about it for 10 years. My housekeeper was like, Mary, we really need to get to your closet. And I'm like, I just don't have the energy yet, Keita. We'll do it. He puts the pellet in. I kid you not. The next day, I got up, looked at that closet, and for 8 hours, I went through my closet. I cleaned it out, did the shoes, bagged up. 25 bags I donated
to the Red Cross. The Red Cross called us the week before, too. It's great planning.
They come out and they took it. I said, I can fill up your truck. So my closet looks amazing.
It does. It looks great.
But the thing is, it was the difference.
Testosterone. Energy.
I had the energy. I felt good. And
you lifted those big bags. I had to take all of that out to the street, Mary. Those bags were heavy. I was in shock.
I said, Don, be careful. They're heavy. Because
I'll put them in the back of my car and hold them to the street.
Okay, so I am a living testimony. Testosterone, ladies, you need testosterone. You won't grow a beard.
No.
And if they do it right, you're not going to lose your hair.
Right.
And yet you're going to have energy. You need that energy.
Now, women, if you're losing your hair, I put some women on finasteride, a half a tab, 3 times a week, Monday, Wednesday, Friday, and it'll save your hair. Some women lose hair. So it only occurs in 5%, so not that many. But we can protect you from hair loss. What else testosterone does real quick? Strengthens your bones for men and women. So many women get osteopenia, osteoporosis. We reverse that. It's so easy naturally without all these bisphosphonates, Actonel, Boniva, Fosamax, the reclassed, all of those meds. We can use it with we can reverse it with simple things. Our Silical 1, 2 tabs twice a day. Our Mega Vitamin K2, 1 a day. Our strontium, 3 a day. Empty stomach, doesn't play well with others. And the testosterone. But also progesterone helps, and some estrogen will help too. But it strengthens your bones for men and women. What it also does, it helps with the heart. There are more testosterone receptors in the heart than any other tissue in the body. Back about 8 years ago, I had a man who came in with severe heart failure. He was on all these meds. He was on the heart transplant list. His ejection fraction tells you how strong the heart was less than 20%. We put him on testosterone injections. This was over 8 years ago. I put him on a lot of coenzyme Q10, a lot of D-ribose, other nutrients to strengthen his heart, along with a healthy Beyond Keto type of diet. And his heart strengthened. His ejection fraction came up to normal, 60%. The cardiologist couldn't believe it. Couldn't believe this was his numbers, and they took him off the transplant list. He's living a normal life, doing normal work, stronger than most men his age. He's about 70, but doing amazing. That's because testosterone strengthens the heart. It also dilates the blood vessels. It boosts nitric oxide. By dilating the blood vessel, it helps blood flow to the heart, but blood flow throughout the body, especially helping those with ED. So many guys get ED. We're going to do a full show on ED because we got the answers to that for men. So it works amazing. So testosterone is one of the keys. Also, what it does, it helps protect men against prostate cancer. So many doctors have the false belief that testosterone causes prostate cancer. Men with low testosterone are much more prone to develop prostate cancer than men with high to high normal testosterone levels. So again, they've done over 18 studies. A collaboration of 18 studies showed no connection between increased risk of prostate cancer and higher testosterone levels. So again, testosterone does all of this for a man, but what you got to be careful with is when doctors put men on testosterone, it many times raises estradiol levels. And then if that estradiol goes above 50 or actually above 43, that's too high for a man. They can start growing breasts. It increases your risk of a blood clot. It can cause all these weird side effects. Men start wanting to watch girl TV or start being chatty Cathys and have all these feminine type characteristics. So my men, I put all my men on my hormone zone to lower the estradiol, and this will lower the estradiol levels, and it'll also help with protecting, supporting the prostate. So I put them on 150 milligrams of the hormone zone twice a day, or DIM. You can use DIM. And so that keeps the estradiol levels from spiking. A lot of men, as we age, this enzyme aromatase increases, and that hormone aromatase will convert testosterone to estrogen. So some men are super aromatizers, and their estrogen go up to 100, 200. And so that's why I always check that estradiol 2 to 3 months after to make sure they're not super aromatizers. Sometimes the wives will call me even sooner and say, hey, my husband's acting strange. He's wanting to watch female TV shows and dramas and all of these, soap operas and things like that.
He cries at the drop of the hat, and he used to never cry.
Well, that's estradiol is spiking, so we got to get it down with the hormones.
And what do you recommend that people take this? One twice a day?
Yeah, that's what I do. I take one twice a day.
One in the evening?
Exactly.
And you can take it with food, empty stomach, doesn't matter.
Yes.
Does not interfere with any meds. None.
No, not at all.
This is all natural.
Now, again, the other thing that boosts testosterone is the testosterone zone. This has the most amazing. Now, I had this in a powder years ago. It was our testosterone zone.
But it tasted terrible.
Well, it tasted okay, but it gave tremendous results. I had one guy that came in and his testosterone levels were 1,000. I said, oh, you're on testosterone pellets or you're taking shots? He says, no, I'm taking your testosterone zone. Well, I couldn't get that much ingredients into a capsule. Finally, we're able to. We're able to take
this is exciting.
The tomcat and the long jack herb. We're able to make it a 200 to 1 concentration, 250 milligrams. It's got that in there, which is very potent to boost testosterone, as well as it contains.
Can women do this with?
Women can, but it works best for men.
Okay.
It also contains the testofen, 600 milligrams, that boosts testosterone, and the boron, 10 milligrams, and all the nutrient cofactors, along with biopurine to help the absorption. So you take 3 of these in the morning. It used to be in this big scoop of testosterone zone, and some men would get some loose stools, and some would, but it helped their testosterone. But it's got the tremendous benefits without the problems. So I'm really excited about this. It's our testosterone
so you
zone.
prefer for women to do creams?
The creams work great. The pellets and creams, yes, and sublingual tabs. We'll use some sublingual tabs in women too.
So mainly for men, guys.
Right.
So that's okay.
Now, testosterone in women, the same type symptoms we see in men. The low energy, their energy tanks, low sex drive, no libido. They have the loss of muscle, the depressed mood, the loss of body hair, the weight gain, the brain fog, the depression and irritability, and they get leaky bladders. And all of a sudden they have to wear pads all the time. Well, testosterone helps that. And we sometimes use testosterone cream applied to the vaginal area, and it strengthens the tone, and it helps prevent that along with weight loss.
I can testify to that for women with testosterone. When you get on testosterone, I used to, listen to me, I know, I just tell it all.
She does.
That's okay. I have no pride, none. But I used to, when I would get giggled or laugh or sneeze real hard, I'd think, okay, have to start wearing those crazy things,
Pads.
you know.
Depends. No,
Not depends, but those other.
The pre-depends.
Well, I have to tell you that when a woman goes into menopause, she's very happy to leave those other things behind. It's like, woo, you're free.
No more period.
Right. And so as you get older and then that begins to go, you're like, dang, I got to get those things back again. I'm not going to talk about what they are.
Those things.
I hated them. I'm free.
Amen.
That's what happened.
Now, the other thing that...
It helps. It works.
It does work. The other thing testosterone does for men and women, and probably one of the most important things that'll keep you out of a nursing home, it protects your brain. It increases the brain-derived neurotrophic factor, just like estradiol does for you women. But it does this for men, and it protects your brain against dementia. It's one of the most powerful things to protect your brain, but it also helps you with depression. So again, twofold function in protecting your brain and protecting you from depression. So again, testosterone is the key hormone, the key spark plug of life for men and women. The benefits are amazing what it does for you.
Folks, listen, the biggest gift you could give your marriage, if you're married, is to do this. Because we have a saying, do not get divorced until you've had your hormones, both of you, checked.
Balanced, but even better, optimized.
Yes, optimized. We like it the upper end.
Yes, upper end of normal.
The upper end feels better. You live better. The thing is this, many times what happens is men get their hormones balanced and women don't. And then next thing you know, you have a divorce.
That's right.
Or you have someone having an affair because the other one has no energy there, no interest. The best gift you can give your family and your marriage is get your hormones checked. Find out your numbers. Get a hold of this book, Dr. Colbert's Hormone Zone. He tells you everything in this book, what your what your levels need to be, what the blood test you need to take. Share this with your doctor friends and the doctors you go to. Encourage them to watch this video. We want to get everybody on the same page. We can make a huge change in our society and turning things around from the way we think. You know, there's a word in the Bible that says, my people are destroyed for lack of knowledge. And boy, if that is ever the truth in medicine, because we are seeing some of the knowledge is just upside down. And it's not accurate, it's not true.
And if you're not on these hormones, you will most likely be on all kind of meds with all kind of side effects, especially those antidepressants and those osteopenia, osteoporosis meds.
You have to own your own health. Don't turn it over to your healthcare provider. If you turn your health over to your healthcare provider, you're going to grow old,
Yes.
miserable, and be on a lot of meds.
Absolutely.
Typically. There are rares,
Cases, yeah.
but typically that's true. God bless you, and thank you
bless.
for listening. And share this video and share the podcast with your friends. Do them a favor. They'll love you for it. God bless you.
God bless you.